So in the context of breathwork and pranayama, one of the things that I like to emphasize the most is that lengthening the breath is something that we generally try not to force. So this is a short practice that I'm going to guide you through that will help you to explore lengthening your breath as you familiarize yourself with the expansion and contraction of the lungs. So go ahead and close your eyes. Find a comfortable seated position. And I want you to just begin by observing. Notice your breath. Notice the inhalation and the exhalation. And just watch the rise and fall of the chest. And I want you to begin to assess for yourself, where do you feel movement? Where do you not feel movement? Do the ribs move at all? Is the breath all in your belly? Is it up in the neck and shoulders? And what I want you to do is gradually hone your awareness in to the rib cage. And I'll have you take your forefinger and your thumb and gently wrap them around the base of your ribs. And once you've wrapped them, you're going to gently drop the shoulders and feel that gentle squeeze of pressure in on the rib cage with your shoulders dropped. And now I'm going to have you breathe into that pressure. So as you inhale, you expand out into the resistance of your hands and just feel that engagement of the rib cage as you breathe in. And then as you breathe out, feel the pressure of the hands gently pulling or pushing the ribs in. We go back and forth. We inhale, let the ribs expand against the pressure of the hands. And we exhale, let the hands press the ribs back in. And as you do this, I want you to see if you can begin to not control, but manage the length of the breath. Can I slow down that inhale a little bit? And can I resist the pressure of the hands as I exhale to slow down the out-breath? Just seeing what's possible. And then I want you to lower your hands and see if you can maintain your awareness of that lateral movement of the rib cage. As I breathe in, trying to reach out gently through the ribs. And as I breathe out, feel the ribs contract in towards my midline. Back and forth. If you're familiar with yogic breathing, where you're breathing in and out through the nostrils with a gentle sound in the pit of your throat, like a hissing sound, I'd like you to use that breath. Otherwise, silence, or just really soft breath all through the nostrils, if possible. And then I'm going to begin to count out your breath, and I want you to see if you can follow my count. If at any point the breathing feels strained, you can stop. So let's all get on the same page. We take a nice slow inhale. See if you can feel the ribs moving. And a slow exhale. And in. And out. Now we'll do 4 seconds. Inhale, 2, 3, 4. Pause and exhale, 2, 3, 4. Pause. Inhale. Pause. Exhale. Pause. Inhale. Pause. Exhale. Pause. In. Pause. Out. Pause. In. pause, out. Now 5 seconds. Pause. In, 2, 3, 4, 5. Pause, out. 2, 3, 4, 5. Pause. In. Pause, out. Pause. In. Pause, out. Pause. In. Pause, out. Pause. In. Pause, out. Now 6 seconds. Pause. In, 2, 3, 4, 5, 6. Pause, out. 2, 3, 4, 5, 6. Pause. In. Pause, out. Pause. In. Feel that gentle stretch of the ribs as you pull out. Pause, out. Gentle contraction of the ribs as you breathe out. Pause. In. Feel the stretch. Pause, out. Slow, controlled exhale. Pause. In. Pause, out. Pause. In. Pause, out. And now, take a break. And come back to breathing normally. And I want you to just notice, see what's shifted. Do the lungs move any more freely? Is there any more space in my breathing? Or less, for that matter? Did I feel like I was able to naturally and gently increase the length of the breath? Did it feel like I was forcing it to happen? And if the latter, I encourage you to continue practicing this and allowing space for your breath to naturally expand with you, rather than willing it to be somewhere that it naturally does not want to be. So, simple practice you can work with, doesn't take long. The focus should really be on trying to smooth out the length of the inhalation and the exhalation, almost like a sine wave. So that as you breathe in, there's this gradual increase with this moment at the top of suspension before the exhale comes back down, moment of suspension at the bottom and back up. Some people like to visualize an ocean wave rolling in towards the shore and coming back out to sea. Pick something that helps you to work your way through it. So hopefully this is a helpful practice for you to explore. Thank you.